person. And now I just want to introduce one of my favorite people, and one of the most powerful people I met, Justice Gaines.
Good morning. My name is Justice Gaines. I'm the Career Justice Coordinator at Providence Providence Youth Student Movement. Sorry, PSU. But I'm the Career Justice Coordinator at PrYSM. Thank you, Luis Daniel Munoz, for inviting me here and for allowing me to be on stage with these folks. I want to take us back real quick because all the disparities that you're hearing today didn't just happen. Before the pandemic started, before a year ago, there was a lot of medicalized racism and environmental racism that gave Black folks, that gave Indigenous folks, and that gave people of color and Southeast Asians in our community a higher likelihood of having things like asthma, of having things like diabetes, of having respiratory problems, of having issues that allowed this pandemic to create these disparities, that allowed this pandemic to create higher death rates for our community and higher hospitalization rates. This isn't a new problem. This is a problem that's been built off of decades of racism towards BIPOC communities. And during the pandemic itself, we saw that people of color were much more likely to work essential jobs and thus be at risk of being exposed to this virus. We know that they had less access to childcare, less access to green space, and were more reliant in this state on public transportation, all of which increased their risk, and it still increases their risk of contracting COVID and potentially being harmed by it. And now we're looking at the disparities of this vaccine, which aren't going to just happen now. They're going to continue through the next few years as we see white populations more vaccinated and people of color still struggling through a pandemic that the country is trying to say is over, or that the country is saying we're reaching a new side of. Now, I, for one, know that I'm very excited to get back to some level of normality where I can be in community with my friends and where I can be in community with my loved ones and my chosen family. However, as someone stated earlier, there's this false perception that by getting to that idea, we are gonna actually hurt our community. We're gonna hurt a lot of BIPOC folks, a lot of brown and Black folks who are excited to get back to normal, but their communities have not been treated with the proper equity to make sure they can do that safely. I'm not really actually looking for another normal. I'm looking for something new, where BIPOC people are prioritized, where we are not second-guessed, where we are given the health, the access, the resources that we need to be a strong and safe community, where we're looking at public safety from an equity lens, and we're looking at what that means for our Black and brown folks. We're not just looking at what that means for the statistics across the country on per data vaccinations. Everyone on this stage doesn't even always agree all the time, but we are all here to say that Black and brown people deserve a fair shot at getting these vaccinations, deserve a fair shot at making sure that their families are going to be safe during this pandemic, and that we can end this pandemic, that we can come out of this pandemic with a stronger Black and brown community in a more equitable Rhode Island.